In 2022, at least 2,272 lives were lost as a result of drug toxicity. This equates to approximately 6.4 deaths per day. Drug fatality data from 2021 has also been revised upwards to reflect additional testing results received throughout last year. We now know that in 2021, 2,306 lives were lost as a result of drug toxicity, and that equates to approximately 6.3 deaths per day. BC has experienced an average of 6 deaths every day of every week for 2 years due to toxic drugs, and these deaths were preventable. All parts of our province are experiencing the impacts of the toxic drug crisis. And while we have seen a small decline in 2022 in the provincial rate of death due to toxic drugs from 44.2 to 42.7 per 100,000, 3 of the 5 health authorities experienced their highest rates of death ever in 2022. Interior Health Authority with 46 deaths per 100,000, Vancouver Coastal with 50.5 deaths per 100,000, and Northern Health Authority with 59.5 deaths per 100,000. From our valued colleagues at the BC Centre for Disease Control, we know that those in local health area Vancouver Centre North are dying at a devastating rate as a result of toxic drugs. We also know, however, that the 319 deaths in that community, which includes the downtown east side, represent 14% of the lives lost province-wide, and that more than 1,900 drug toxicity deaths occurred elsewhere in the province last year, in both rural and urban areas, and in communities big and small. As has been consistent since the beginning of this public health emergency, the vast majority of those dying are males, and 70% of those who died were aged 30 to 59. Children and youth continue to represent about 1.5% of the total number of drug toxicity deaths last year, and the actual number of those under age 19 dying has grown as the total number of deaths continues to increase rapidly. In the past 2 years, there have been 65 deaths of children and youth. Provincially, drug toxicity remains the leading cause of unnatural deaths in BC, significantly surpassing the total of deaths due to motor vehicle incidents, self-harm, and homicide combined. According to the BC Centre for Disease Control, amongst all causes of death, including those from natural causes, illicit drug toxicity was the leading cause of death for those 19 to 39 years old in 2021, leading other causes of death in this age group by a wide margin. Illicit drug toxicity was the second highest cause of death provincially for those in the 40 to 59 year age group, edged out just slightly by malignant cancers. And drug toxicity is also the second highest cause of death for those aged 10 to 18 years of age in BC. Provincially, from November 2021 to October 22, deaths due to drug toxicity came second only to cancers in terms of potential years of life lost in our province. And the average age of someone dying from drug toxicity was 44 years old. These are population characteristics, but we all know, of course, that these numbers represent people who were loved, who were valued, and who are now greatly missed. Some had been experiencing problematic substance use for a number of years. Others used substances occasionally. Some sought opioids. Others believed they had purchased stimulants and died unaware that what they purchased on the illicit market contained fentanyl. These deaths were preventable, and these lives mattered. Since the beginning of this public health emergency, illicit fentanyl has driven the crisis, and in 2022, fentanyl was detected in 82% of drug toxicity deaths. The illicit drug supply continues to be highly unpredictable. Extreme fentanyl concentrations fluctuated in 2022, being detected in 7 to 19% of deaths, depending on the month. Carfentanil continues to be detected, though slightly less prevalent than last year, and was seen in an average of 10.5 deaths per month in 2022. Etizolam, a benzodiazepine analog, was found in 35% of illicit drug toxicity deaths that had undergone expedited testing. There is no indication that prescribed safe supply is contributing to illicit drug deaths. The Coroner Service has a mandate to investigate all deaths that meet the reporting requirements of the Coroners Act, and the Chief Coroner may direct inquests and establish death review panels. A death review panel reviews the facts and circumstances of death for the purpose of providing advice to the Chief Coroner respecting medical, legal, social welfare, and other matters that may impact public health and safety and the prevention of deaths. In March of 2022, a Coroner Service death review panel released its review of 6,007 illicit drug toxicity deaths. The panel's advice for reducing the number of deaths due to drug toxicity focused on three main areas: a safer drug supply, a coordinated, goal-driven provincial strategy, and a comprehensive continuum of substance use care. The panel also reiterated the recommendation from the 2017 Illicit Drug Toxicity Death Review Panel, the need to provincially regulate and appropriately oversee treatment and recovery programs to ensure that they provide evidence-based quality care and that outcomes are closely monitored and evaluated. In January 2023, large gaps remain in all of these areas. As we continue to experience significant losses of life across the province, these recommendations continue to be relevant, and actioning them is an urgent need. More than 11,000 people have died in BC since the declaration of the drug toxicity public health emergency in April 2016. A conservative estimate is that there are currently more than 73,000 British Columbians with a diagnosis of opioid use disorder. The prevalence of those using substances continues to grow, and those at direct risk of dying from the toxic, unrelated drug supply run the gamut from people who use substances occasionally, whether opioids or stimulants, to those with severe substance use disorder. All of these thousands of people, our neighbors, our colleagues, our loved ones, and communities across the province are at risk of death and serious injury. Representative Jennifer Charlesworth has told us that children and youth in our province are being significantly damaged by the toxic unrelated drug supply, both in experiencing harms from using substances themselves, but also in suffering the loss of siblings, parents, grandparents, and caregivers. As this crisis continues, we are facing mounting levels of intergenerational trauma. The Coroner Service has a mandate to investigate deaths in the province and may make recommendations to prevent loss of life where possible. We will continue to use every means we have to reduce the death toll in BC. To that end, and as we enter the 8th year of this public health emergency, I have established a third death review panel, bringing together a group of diverse, knowledgeable, and experienced subject matter experts to help to continue to innovate and collaborate to save lives. I look forward to receiving and sharing their recommendations. Before I call on Dr. Wayman and Dr. Bach, I would be remiss not to note that this is the first day of decriminalization of people in BC in possession of 2.5 grams of opioids, cocaine, methamphetamine, and MDMA for personal use. This is an historic and incredibly important change that reflects a shift from marginalizing and stigmatizing those who use drugs to acknowledging that they are people we value and care about. It is a key first step, and as we've heard from both the federal and provincial mental health and addictions ministers, it is one measure of many that are necessary to end this crisis. I'm very proud of our province for this historic recognition and hope we can continue to be courageous and innovative to reduce harms and save lives.